The benefits of using the oral appliance are quite dramatic for some people. For some people, they just don't want to snore anymore for their spouse, and people complain that they're snoring. And so for those people, they're just happy to have that happen, so they're not snoring, and they can oftentimes sleep with their partner again, and which is nice, and it's rewarding for me as a dentist to be able to help that happen. The other benefit, though, and more importantly, is that their quality of sleep increases. If you can imagine stopping breathing, several times to hundreds of times in the night, just because that airway is closing off enough that you're not getting that oxygen that you need, you're at higher risk for those cardiac events. Your blood pressure increases, your heart has to work harder, all those types of things. And so the benefit to having the airway open with the oral appliance just allows you to actually have a better quality of sleep. And so if you can get that quality of sleep, you're definitely going to feel more refreshed in the day. You're not going to be falling asleep as you sit down to watch TV, all those types of things. And so I've done a lot of these appliances with patients, and that's probably the biggest thing that I hear from patients, is that they feel refreshed in the day. They don't wake up as much in the night because they're probably not gasping, from having that airway close off. And again, just their spouses are happy because they don't hear them snoring. In fact, the first time they get the appliance, oftentimes, because they don't make any sounds, the spouses are more worried about that, if they're breathing or not, and so they're stopping to find out if they're breathing. So once they figure out that they're fine and they're doing well, and there's no snoring, and the patient's feeling better during the day, it's rewarding for me as a dentist to see that happen with the patients.